Pamela, do you want to tilt your camera down just a titch?
Down?
Mm-hmm. Perfect.
All right, everybody, welcome to our second act. This is our third live event we've done so far. We're really excited to have all you guys on here. Today, we are going to be talking about Are You HeartAware? If you do have any questions, we would love for you to ask our speaker. You'll just type them in the box that's below our live stream. It says, do you have a question for our presenter? And you'll just type it in there and send it. And we'll try to get those answered either during the presentation or right after. But we do encourage you to ask as many questions as you would like. Also, following the class, you'll receive a survey via your email. So please fill that out so that we can kind of see what we're doing good and where we need to improve. Again, we're very excited that you guys are on here to learn today. And without further ado, I will present to you our presenter, which is Amelis Brooks. She is our SIH Interim Manager for Cardiac Management Center. And we are so happy to have her with us today. And if you want to take it away, we'll hand it over to you.
Okay, thank you so much for having me. I just want to say hi to everybody. I just wanted to start out by saying that this is one of my first times presenting this, and it's definitely one of my first times presenting without people being able to talk back to me or at least give me a funny look. So with that being said, I just want to say how honored I am to be here and say hi to everybody that's watching. I am going to talk about HeartAware. It's one of SIH's health screenings that we're using just to bring awareness to cardiac health and kind of awareness to just SIH's investment into the community and in your health. So I'm going to go ahead and share my screen, and we're going to go over a few things. I did a PowerPoint, so bear with me here. Okay, so again, I'm just going to talk about owning your health and knowing your risk for heart disease. One of my utmost passions is just patient advocacy and just awareness of your own health. I think the most powerful thing that you can do for yourself is knowing what medications you take, what what issues you might have, whether it be high blood pressure, high cholesterol, diabetes. Just kind of having that awareness and kind of owning those things and advocating for yourself, advocating to your healthcare provider, to your family, and just using that to improve your health and ask questions and, just make sure that you're doing everything you possibly can do to be as healthy as you can be. So to start a little bit about myself, I'm a nurse. I have a master's in leadership and management. I've been in SIH for almost a year, but I've been a nurse for almost 20 years. So been doing this a very long time. I worked in Kentucky, Missouri, and now here in Illinois. Just something about myself. I do live on a farm and I have a lot of animals. So many animals that my husband sweats when I come home because he knows I have another mouth to feed when I come home. I pick up everything I can find on the side of the road. I cannot say no to a helpless animal. So we have 4 rescue dogs, 2 rescue cats, 4 rescue chickens, 20 chickens that are just my babies, and I have 2 pot-bellied pigs that are our joy. I also have kids, but I talk mostly about my animals. But yeah, so I kind of live out far and I rescue everything. So that's just a little bit about me. I do work at the Cardiac Management Center over here in Marion. It is a heart failure clinic, so we treat heart failure patients outpatient, and we try to keep heart failure patients from progressing in their disease and staying out of the hospital. That's our main goal over here. Okay, so again, I just want to talk about the importance of awareness of knowing your risk factors for different disease processes, knowing if you have symptoms, you're experiencing symptoms, maybe you don't know it's a symptom or a warning sign for a bigger problem, owning that and using that to make change in your life. There's a million ways you can do that. I'm just going to talk about a few. Healthcare, owning your health, patient health, those are all very overwhelming things, and it can feel just like, oh, I just want my doctor to tell me what to do and I'll do it, or I just want to, I trust my doctor to do everything. I'm not advocating for not trusting your doctor. I'm just advocating for asking questions, understanding what's going on, and so that way that you can speak for yourself. You can ask, is there a better way? Is this my only option? Things like that, because all of those kinds of things can help make you have a better outcome. So we're going to start with just awareness. So knowing your risk factors, and we're going to focus on the heart. So knowing your cardiac risk factors and knowing what symptoms that you need to be looking for. So specifically through HeartAware, HeartAware is an online risk assessment. It's offered through Southern Illinois Healthcare. And essentially, it's just a questionnaire, asks you a series of questions. And the series of questions, the end result is it lets you know if you are at risk for developing heart disease or if you're in danger of having a heart attack or stroke. It only takes approximately 7 minutes to complete the risk assessment. And it's free. You're not signing up for anything. We're not hooking you into anything. It's totally free for you to do this. Where can you find it? You can find it on the Southern Illinois Healthcare website. So you would go to sih.net. You would just open your browser, your normal web browser, and enter sih.net in that browser. In that browser line. That will take you to our main page, and I'll walk you through that in just a second. Another way that you can take the assessment is if you have a smartphone, you can text the 217-600-2249. That, when you text that, you're going to text that in the body of your message and hit send. That is going to return a link for you to take the assessment. Once it sends that link to you, you'll hit the link. It'll normally be highlighted in blue. You'll hit that link and it'll automatically take you to the health assessment page, and you'll start from there. The other way, the easy way to do this is to call me. So you can call me anytime, during the day, and we'll do it together. I'll get online, I'll ask you the questions, I'll fill everything out for you, and we'll talk about it. We can even talk about your results right then and there. You can save you another phone call. If you're not comfortable coming into the clinic to discuss it, we'll talk about it over the phone. So I'm always available to you. I want to be a resource for you. So that's another easy way to take the risk assessment. So just to kind of go into a little bit more detail, this is the SIH main page. So you would, again, in this section on the website, you would just type in sih.net. It's going to bring you to this main page. You're going to scroll down just a little bit. This is a little bit halfway down the main page, and you're going to see take a free assessment. You're going to click on this yellow bar where it says take a free assessment. And that is going to take you to this page. And on this page, there's a video that talks about what HeartAware is. There's my phone number again. There are all sorts of resources on this page through Southern Illinois Healthcare. Maybe you're not feeling really well and you're just sitting here browsing. there's a link to our urgent care, a link to My Chart. My Chart is a fantastic resource that SIH offers that you can communicate with your physician, look at results. Maybe you've had a test. All of that is right there, easy to access through My Chart, and there's a link there. Again, all of our resources, services, treatments, anything you might want to know about SIH or community resources is going to be on the SIH website. But to take the HeartAware risk assessment, you're going to, again, click the yellow bar, and it says take this free assessment. So that's how you would take it. Again, it'll ask you a series of questions. And when you're done, it will send you a report. So when you're done, you will get an email with a detailed report. This will highlight your risk factors. It will alert you if you have any symptoms that could be warning signs of a stroke or a heart attack or anything like that. Maybe you don't recognize those symptoms. They can be kind of ambiguous at times, but this report's going to pull those things together and highlight that for you and say, these are warning signs, these are symptoms. I will call you also once I receive that you took this assessment. I'm going to offer you a free in-person or over the phone consultation. I would love for you to come in and see me at the clinic. I'd love to meet you. I'd love to talk about everything. Again, if we were in person right now, we could even go and do it right now. But unfortunately, we're in a different world. So again, you can call me, or I will call you with with that option to come in and talk to me, or we can go over your results over the phone. So next, that's when the ownership portion of this comes in. So you have the knowledge, you have the risk factors, maybe the warning signs. Whoa, I didn't realize that these were risk factors, or I didn't realize I had these symptoms. So now you know. So now what do we do from there? What are our next steps? How do we address this? What are my resources? What are my options? So this is what I can do for you. When I call you, if you're willing to discuss things, I'm going to go over your results in detail. I'm going to talk to you about your risk factors and your symptoms. I can find out more details. I can see what's leading up to them, or what was leading up to them. What are the other circumstances surrounding these things? We can communicate with your primary care provider or your cardiologist. If you already have a cardiologist, I can right then and there call them. I can advocate for you by calling your provider. We can sit and make a list of questions that you can ask at your next doctor's appointment. We can review your medication list. I'm not a doctor, but I have a lot of experience. I can't tell you exactly why you might be taking a medication, but we can talk about what the medication is for. Maybe we can come up with questions to talk to your doctor regarding your medication list. I can assist you in writing your medication list out. I have cards where you can keep a list in your wallet, which I highly recommend for you to do. I have all those resources here. If we do discuss these things over the phone, I will send everything to you in the mail. And that's another thing. If we call and connect, I will resend. If you can't get into your email, or you don't have access to print out the report at home, I'm going to print out that report for you, and I personally mail all of those results to every person that takes this assessment. So I have been doing that, and I throw a few goodies in there for you. I do throw the medication cards that you can fit in your wallet, where you can keep track of your medications. I'm going to mail you one of those. Everything we can do to empower you to own your health, we're going to do it. Another thing we can do, if you do not have a primary care physician, I can assist you in finding one within the community. We'll find the best fit for you depending on your needs, your geographic location, etc. We also have a protocol that has been approved by one of our prairie cardiologists. If a cardiology consult is appropriate, I will consult a cardiologist for you and make you that appointment. And I will make that a seamless process. We will arrange all of that for you. If we find that that's necessary, we will definitely get that done as well. I can also connect you with resources within the community, within SIH, or just within Southern Illinois. I have all of that information also. So there's a lot that I can do for you. All you got to do is pick up the phone and call, or take the assessment, and I'm going to call you. So the result of taking the assessment, talking to me, doing your consultation, you become empowered. You become your own health advocate, and maybe you don't feel like you're capable of being your own advocate. We can share this information with a family member. You can share this information with a friend, or I can advocate for you. I really want to be a resource for you. I really believe that knowledge and awareness empowers you. I feel like it leads to better health, to better outcome, to better results. So really, that's why I'm here for you. That's really the goal of this program, is to empower you and to keep those catastrophic events from happening. We want to stop strokes and heart attacks. We want to stop them before they happen. And the only way to do that is to really acknowledge and understand your symptoms. I'm going to go ahead and just put my information back up there. This is my name, my email, my phone number. You can also call our heart failure clinic and just ask for me. I don't have a number where you can push and it automatically goes to me. So you just have to ask. The girls know, that we're doing HeartAware. So you just have to ask and they'll connect you straight to me. And honestly, you can call any time of day, like I said, my cell or the clinic, or you can email me. I'm pretty responsive. I check my email every day. Again, things that I can offer you are just knowledge, empowerment. I can answer your questions. Definitely connect you to any resource. If I don't know the answer, I promise to find the answer. Anything you might need. I definitely am eager to just forge a relationship and help. It is truly our goal to just have a healthier community, healthier patients, and more informed patients. Are there any questions, Kayla?
Yeah, so one of our questions that we have is, can thyroid disease affect a heart condition?
Absolutely. So the answer is definitely yes. Thyroid disease, so how well your thyroid functions, whether it's functioning hyper or hypo, definitely has a impact on your heart. Thyroid function can speed up your heart. It can increase your blood pressure. In fact, if you do have symptoms of a racing heart, typically when you come into the emergency room, a thyroid panel or thyroid labs are one of the first things that typically clinicians check. So it's kind of one of the things that we check for first. So definitely your thyroid function can affect your heart rate, and your blood pressure.
Awesome. Thanks for answering that. Mm-hmm. Another question is, what are some of the positive things you've seen come out of HeartAware so far? And do you feel that it is pretty effective in helping individuals figure out kind of the best steps to take?
Absolutely. So yes, typically what I've seen coming out of HeartAware is just kind of, it brings up the point. So it's asking the questions and it's making it's making the person think about their health, making them cognizant of things that they're experiencing within their body. For example, one of the questions is, have you experienced shortness of breath that's new within the last 6 months? So that makes you think, hey, have I been short of breath in the last 6 months for no reason? Is this new for me? It kind of brings that to the forefront of your mind. I've actually had 2 people take the assessment that answered the question yes. And when I brought them in, typically the response is, well, I didn't even think about it. Yeah, that's happened, but I wasn't even thinking about it. I wasn't thinking that that's something that's abnormal or something that could indicate that something could be wrong with my heart or my lungs or anything in my body. But what I try to explain is shortness of breath, chest pressure, lightheadedness, dizzy. That's how our body communicates with us. That's how our body says, something's wrong. I need you to stop, and I need you to recognize it and do something about it, or I'm not going to keep working correctly for you. So, just starting that conversation and making people aware has had really positive results. So for those 2 patients, one, I made an appointment with her primary care provider. The other one was having chest discomfort on and off for the past 6 months, and I made her an appointment with a cardiologist. So, and she had a lot of risk factors, family history that really pointed to maybe this could be a cardiac problem. And, it definitely, I think it's a positive, that was a big positive impact. I mean, if that keeps her from having a massive heart attack, or it leads to a stress test that shows that there was a blockage, all of those things are life-saving decisions. And it's so simple and so easy to take the assessment and find that out. So yes, definitely seeing a lot of positive things. Any other questions?
I did have one more question. I'm not sure if you are aware of Dr. Dean Ornish's program, which is Reversing
Yes.
Heart Disease.
Yes.
Do you have any thoughts, opinions, success, or otherwise on this?
So actually Prairie Heart, which is our cardiac, our heart group, and we collaborate with them. They are the group of cardiologists that practices in Carbondale, Marion, and the surrounding areas. And I can get all of that information for you, where they practice, where they have clinics, what physicians go where. I can get all that information. So anyway, Prairie did a study, a trial with, I think they ended up with 10 patients, 8 or 10 patients, where they did Dr. Ornish, they followed his guidelines and did that diet. It's a vegan diet. And those patients had a reverse in heart disease. It showed restructuring of the heart muscle. Those patients were able to, they followed up with echo and all kinds of labs, and they were actually able to reverse heart disease with this lifestyle. That is a very powerful way to treat heart disease. And to me, I mean, is it Hippocrates? I can't remember, where he says food is medicine. And I truly believe that food is truly medicine. And that's a perfect example of it. So yes, through that study and through other studies that have been done regarding that, I think there's a lot of value to it. I think anything that decreases inflammation in your body is going to reverse disease. And that's a lot of what Dr. Ornish's studies show, that the diet decreases inflammation. So you are eliminating all inflammatory foods, fried foods, meat, sugar, oils. I don't think there's any oil on that diet either. And all of those cause inflammation. Inflammation causes disease, to put it simple. So yes, I think that's a very powerful way to treat heart disease, and I think there's a lot of value to it if you can do it. It can be difficult to do.
That is so true. Diet and exercise are two of the best things you can do for anything.
Absolutely.
But if you can get it accomplished, I would say that it is a great thing for your heart as well. Another question we have is, so down here in Southern Illinois, you can see a regular doctor in Carbondale, but do you have to travel to St. Louis or another city to get advanced heart care, or is that something we offer around here?
That's a wonderful question. That is definitely one of our goals for the community, is the awareness of everything that we can do here. We do offer advanced and complex cardiac procedures. A lot of things that they're doing at St. Louis and Barnes, we actually do here. Examples are, we have a treatment for atrial fib called a Watchman device. We have treatment for aortic valve disease. We call it TAVR. We do complex, we call it our CHIP program, and essentially what it is blockages that are very complex to fix, that not necessarily a stent or a cardiac stent can fix. We have methods to treat those complex blockages. We have a program that we're starting that will decrease open heart surgery and increase the ability to fix blockages through just a heart catheterization. We're working with Barnes and partnering with Barnes to start that program, and it's already started. It's well on its way. We are the only facility within this up to St. Louis, Evansville, and St. Francis that offer Watchman and TAVR in those higher risk, more complex procedures. And our success rates are very high, very high. We've seen amazing things. So and any information that you need about a certain procedure, or if there's a certain disease process you're struggling with, you want to know if there is a treatment, if you want to know what SIH and Prairie are doing for that specific thing, give me a call and we'll talk about it. We can talk about which physician treats what, anything like that. I can be a resource for you.
Great. Another question is, where are the different heart offices located? Are they only located in Heron or in Carbondale? Do we have anywhere else?
We do. We have a Marion clinic. We have a clinic in Harrisburg, Chester, Anna. Where else? We have facilities in Murfreesboro. We have pretty much all throughout Southern Illinois. We should be able to service or find a clinic near you. We have multiple locations, and I have all of that. I can send to you, I can mail it to you, or email it to you. That we can email you that list and the phone numbers as well.
And what would be one of your biggest tips to anybody out there who might have heart disease in their family, or might feel that they have some underlying issues that might lead to heart disease? What is one of the best advice that you could give to someone?
My best advice would just be to recognize that you have that higher risk. If your family has heart disease, and we know research tells us that those things can be hereditary. So you already have that first base layer of risk. So my best advice would be to recognize that and to take proactive next steps to prevent a heart attack or stroke or blood pressure, high blood pressure. So I would just take any steps I possibly could to prevent further progression of disease. whether that be taking HeartAware, recognizing those symptoms that you might already be having, calling me, asking me any question you want. Another thing would be to just start a conversation with your primary care provider. Hey, my dad had a heart attack at 40 years old. What can I do? What would be the most effective thing that I could do? And then I just really encourage you not to be overwhelmed. We talk about prevention and we talk about, eat right and exercise and don't eat sugar and, do all these things. And it can just be overwhelming and you end up being like, never mind, it's too much. But truly, I truly want people to know one step, one thing at a time, one step at a time. Start with the risk assessment. Start with one meal a day is just well-rounded, healthy fruits and vegetables. Just take one step. I truly don't look at the whole staircase, look at the one step in front of you, but just to be proactive and to be aware and just, start the conversation either with me or your primary care provider.
Yeah, I love that. I like the one step. One step's easier than 50. So I definitely like that.
Yes, it can be very overwhelming.
Exactly. Tracy, do you have anything that you would like to ask or?
I don't know that I guess I'm thinking about these steps we need to take and thinking about the fact that it's winter's upon us. We're COVID isolated kind of, and if you have any ideas or steps to be active or do heart healthy things while you're under these kind of constraints, Amala, we'd appreciate any advice.
Yeah, so that's that's difficult whenever it's cold and we're being told to isolate. Honestly, I know it sounds crazy. Give me a call. Let's talk about it. You can call and talk to me about anything. There's resources in the community that we're having these webinars. I would just encourage you to, even though we might not be able to go at places like we would normally go, there's still ways to engage. This being one example, picking up the phone, like I said, calling, you can call me, we can talk about ways you can, there's all kinds of virtual platforms in our community where you can do exercise class or cooking class. All of these things are virtual. So I would just say try to connect more virtually. Like I said, cooking classes about cooking healthy, heart healthy things. I can send you we're coming out with a new cookbook. I have old cookbooks, but new heart healthy cookbooks, and it's more of a Mediterranean focus. I can send that to you. Make your favorite dish. Give me a call. Let's talk about it. What tasted good? What didn't taste good? I love talking about cooking. I don't cook very much, but I love to talk about it. I'm more of a snacker. I'm always snacking on something. But yeah, so yeah, I mean, just anything and everything to just stay connected.
It's interesting that you bring that up. And I didn't introduce myself earlier. Sorry, I'm Tracy here, and I'm the manager of the Second Act program here for SIH. And I was actually just having a conversation today because near our office, which is in University Mall, we've just had a renovation of what used to be the food court in University Mall in Carbondale. And one of the spaces in there, besides rehab, which is moved in, is a community conference room, our community classroom that includes a kitchenette. And we're just talking today about in the future, we see opportunities to do cooking classes, or maybe, and might have to do it virtual. That's just the world that we're in right now. But those are some exciting things on the forefront that helps answer some of those questions of ways we can get the word out there and take action.
Yeah, that would be great.
And I got one more question for you that just came in. So with COVID and everything going on right now, is it smarter to hold off on getting checked out and not reading? You have Okay, sorry. Let me try again. I can't speak. So with COVID, isn't it smarter to hold off on getting checked out and getting treatment on non-emergency conditions until the pandemic is over?
That's a great question, and I'm so glad somebody asked that question. So the answer is no. It is not better to wait. What we're seeing is patients that wait don't do as well, and those patients are sicker, and disease progresses. And that's what we don't want. We want you to come seek treatment. As soon as you have a problem. We do not want you to delay treatment whatsoever. We are taking all precautions to prevent the spread of COVID and the flu. Now that we're in flu season, SIH is just absolutely the most proactive organization I've ever been a part of. All precautions are taken, and I would say we are overly cautious. And I think you can't really be overly cautious in a situation like this. I feel completely safe. I just took my son to the emergency room. I think it was 3 weeks ago. He broke his arm. I felt completely comfortable. All the nurses and the physicians were excellent. They wore their proper precautions, masks, shields, gloves. Everybody was washing their hands, sanitizing. So I feel like you're completely safe to come in to seek treatment, and truly doing that is life-saving for you. I would highly encourage never to wait, especially if you're having chest pain, shortness of breath, if you're dizzy, chest pressure, anything out of the ordinary like that, please come to one of our emergency rooms. If you're questioning, hey, is this serious? Should I seek treatment? Should I not? Again, give me a call. We'll talk about it. Give your primary care physician a call. Again, I'm here for you. Anything like that, please give me a call.
Awesome. I love that. And so those are all the questions I have, unless you have anything else, Tracy.
I am just today going to say thank you for being patient with Second Act as we learn how to do all of this virtually. It's new for everybody, so every time we do one of these programs, we certainly learn what we could do or change or shift or pivot or whatever, but there's a lot of people helping us, and I appreciate that, and excited to see these starting up again so we can get some information out there. And actually right now, if I can get on my soapbox a little bit, and this is just about what we're dealing with right now with COVID. There is an uptick in cases all over the country, and we are no different than the rest. We're starting to feel that pressure here as well in our COVID units. We are asking people to wear your mask, and ask your friends to wear masks. And it may not be perfect. I know it's kind of a pain, but it's just to help minimize some risk some way. And it is shown to help, along with hand sanitizing and, of course, maintaining your 6 feet of separation. And we're also heading into flu season, so please get that flu shot as well.
Awesome. And then, Amala, if you could unshare your screen really fast.
Mm-hmm.
And do you have any last closing remarks or anything you'd like to share?
No, just I really appreciate that you spent time listening to everything I have to say. Again, please feel that it's safe to seek treatment for any emergent situation. Again, if you're questioning if it's emergent, call me, call your primary care physician. We are here for you. We are a resource for you. And our primary goal is just to have a healthier community. And if you need assistance taking the risk assessment, give me a call. We'll do it together.
Awesome. Thank you so much for taking some time to speak with us today. We really do appreciate it. Also, I just want to give a shout out and let everybody know that we still have some upcoming events for November, so make sure to get into some of those. We're really excited, and hopefully we'll just keep getting better and better. And again, we can't thank you enough, Amalith, for speaking with us today on HeartAware. Make sure to go take your risk assessment. You should be receiving an email shortly with a link to do that, as well as our survey. And we appreciate any and all feedback we can get from you guys. But I think that's all we have for you today, and we'll see you at our next webinar. Bye, everybody.
Bye. Thank you, guys.